Welcome back. We're talking about public health jobs. We're talking about AI in public health. And before I introduce ourselves, I'm going to jump in just with a question that has been asked so many times. I'm going to make it the first thing that we talk about. And then we're going to get into a whole lot of other questions. Just to remind you, this is live. You can ask questions. They'll pop up on the screen. We'll answer them. You might be watching this in the future sometime on YouTube. Happy days. Then just watch along. First question that I get asked a lot nowadays is what public health jobs are going to be important in the future, right? Because if you're a young person, you've just finished an MBA, MPH or something along those lines, and you're thinking, what am I going to be doing in 10, 20, 15 years time? The two things that I tell people that I think are really, let's call them growth areas in public health and in global health are going to be climate change and health and all of that environmental stuff, because that is cooking with gas. There's a lot going on there. It's really important. And
Yes.
changes in climate are going to make a huge contribution to the global burden of disease, et cetera, et cetera. And the other is what sometimes we call One Health. And baked within that is this idea of antimicrobial resistance, right? AMR. That is a massive problem. It's getting worse. And there's going to be a huge need for public health professionals to be engaged in that, leaning and thinking about solutions, et cetera, et cetera. So those are my two little tips for the day. Climate change and AMR, antimicrobial resistance, are the two growth areas. If you're looking for like, what should I do in the future? Boom shakalaka, that's my advice to you. Of course, there's lots of other stuff. Everything's important. Okay, so
Of
anyway,
course.
without further ado, I'm Greg Martin. This is Mbo. Mbo, say hi.
Hello, everybody. I'm Umba. I'll be co-hosting this session with Greg today. Happy to be back again. And I think we're going to jump right into it.
We're going to jump right into it. One of the things I love about Mbo is she smiles a lot, laughs a lot, and that makes me smile and laugh a lot too. So, you know what I mean? That's why we pay you the big bucks, Mbo. Okay, now you might be watching on LinkedIn. You might be watching on YouTube. In either event, you can ask questions. Those questions will pop up on
Yeah.
the screen. And even if you don't have a question, feel free just to say hi. Right. So if I do that, questions and comments should pop onto the screen on the right-hand side or the left, depending on where you're watching. And say hi, where you from, and you could just give us a boom shakalaka, hot diggity dog, anything you want. We will try to respond to everything that comes up.
As much as we can. Yes.
As much as we can. Mbo, before we
Yeah.
get into more questions, I might actually just respond to one of the other questions that have come up previously.
Okay.
And then while people are sort of logging on and looking for their questions, something that comes up often is, are MPH graduates going to be replaced by AI? And everybody's nervous
Question
about
marks.
this. Yeah. So look, this applies to people working in all sorts of fields, right? And we're talking about the medical field, public health, et cetera, et cetera. What I often say to people is this: an AI is not going to take your job. Somebody that can work with AI might.
Might.
In other words, exactly. In other words, we need to get on the train here. We need to
Yes.
learn to work with AI and make sure that this technology is getting the best. We are getting the best out of it, and working with it. We're able to make the sort of most substantial value proposition. And I
Yes, I
don't
agree.
just mean ChatGPT. I mean AI is so much more than that.
Great.
But yeah, what do you think, Mbo?
I definitely am on the same boat with you about this. Like, I remember starting out my MPH, and the only AI tool I knew was ChatGPT, quite frankly. But by the end of by the end of the long 1 year, like I realized there's so many tools out there that can do so many things more efficiently. So you can actually get it done, but it can do it faster and save you time. To be honest, so
Uh,
many tools, and I think we're going to talk about a few of them. We have
we're
to
gonna
talk about a few of them.
Exactly. And actually, during the session today, I'm going to showcase an AI tool that I use all the time. I'm going to put it on the screen and show you how I use it. So that's great. We're also going to be talking about volunteer jobs. So people that are finishing an MPH soon, whenever that finishes, and you're thinking, how do I get that first job when I don't have experience? Well, volunteering is a way that you can do that. If you are already a public health professional, mid-career or senior, and you might be thinking to yourself, I don't really need to know about volunteer jobs because I'm not going to volunteer. Stick around anyway, because you're going to have younger people asking you for advice. And
True.
it's important that you're able to mentor people that are coming up through the ranks, and you can give them advice and point them in the right direction. So even if you don't think volunteer jobs are for you, stick around. It's still important to know about. We've got a couple
Hello,
of people that are
Priyanka.
logging on with some questions.
Yes, and we have
Well, not
Priyanka
questions,
from
but
the
hellos.
UK.
So we want more hellos. I'm going to I'll bring questions up on the screen, and we'll respond to them when we can.
We have one right
Uh,
now, actually.
is something up?
Yes, we have one from Priyanka. She's logging in from the UK and she's asking, she's just completed a BSc nursing in India and she's doing an MPH in the UK and she's wondering what job roles she can apply for and if she'll get sponsored jobs.
Right. Okay. So that's a great question. Thanks very much for the question. So a BSc in nursing in India, pursuing a master's in public health in the UK. So she's got an interesting sort of collection there of sort of backgrounds
Yes.
and qualifications, because she's coming from India, and having a nursing background in India already gives her some of that kind of lower middle income and middle income country experience and
Exposure.
background and
Yes.
exposure, which is often important for some of the global health jobs that you might want to apply for. Right.
Very
So if
true.
you're looking for jobs at the WHO and at some of the sort of big foundations like CHAI or Gates Foundation, et cetera, for certain jobs, not all jobs, but for certain jobs, there's a requirement that you've got some kind of experience in a low income country or a low and middle income country. So she's got that box ticked. She's doing an MPH in the UK. There are excellent schools in the UK, so no doubt she's getting a great education. So I think there's going to be all sorts of opportunities for her. Now, we're going to talk today about those first jobs, right? And how
Yes.
difficult that can be, and some solutions around that. So stick around, and we're going to address some of the answer to her question later on in this live stream. We've got a couple of hellos. So say hi and tell us where you're from. So if you're from somewhere, which you are, put that in the message. We want to know who we're talking to today. If you don't want to tell us where you're from, just say hot diggity dog, boom shakalaka, anything. Like, we want to hear from you. Thanks for the comments. Do we want to jump right in while we're waiting for people to send in their questions? Well, there's another question on the
Okay.
screen at the moment. Let
It's
me
about AI
get.
tools.
Okay, right. And now, how do I get questions to come up on the screen? Okay, well, I'll figure that out in a second. What does this question say? What are the AI tools that we can use while doing an MPH for assignments? Well, I'm glad you've asked, because I am going to talk about one of my favorite AI tools for people that are working on academic projects or reports.
Projects. Yeah.
It's an AI tool that I use all of the time. Okay, so and you're gonna love it. Believe me, it's absolutely, it's gonna blow your mind. So we're
She's
gonna
right
get
on
into
track,
exactly.
You've come to the right
Uh,
place today.
okay, and we've got someone from Nigeria.
Hi,
Mbo, you're from
Deborah.
Nigeria, so
I am
a
from
countryman.
Nigeria. Hi,
There you
Deborah.
go. And just so that people know, I'm from South Africa and I'm living in Ireland at the moment. So if you're from South Africa or Ireland, be sure to say hi. Shall we jump into, let's start, I'm going to get to the AI tools in
Okay.
a minute, and we're going to spend some time looking at that. But before we do, Mbo, do you want to just talk us through some volunteer jobs that are available through the UN? And I know you've got some
Okay.
slides. I'll pull them onto the
Yes.
screen.
Um, I definitely agree with talking about this because it's a very big question, that graduates and undergraduate, postgraduate, even students have. How do I get my first job? And a lot of the times you feel like you have the academic background and the academic qualifications, but what you're lacking is experience. And so we thought about it and decided to bring up a few UN volunteer jobs. You have three schemes. They have a volunteer abroad, volunteer in your country, and a volunteer online job, which is my favorite one because short projects, 2 weeks, 3 weeks, with skills you have and you can do from the comfort of your home, and add to your CV to show that you actually have worked on something serious you know um it's quite a pretty easy website to navigate. You just go to UN volunteer website and you log in, create an account, and then there are so many opportunities. On the next slide, I think I've highlighted a few opportunities. This just goes to show you that you have 76% of volunteers coming from the global south, and you sit there and
That's
think, you know
amazing.
what, I'm stuck. I have no opportunity to work with the UN or work with these global organizations, but there is an in by volunteering. um I think on the next one, yes. So we do have a few examples. So for instance, you have a 2 week translating podcast job for UN women in Thailand. So someone who can speak the language and lives outside the country can definitely apply to that kind of role. Um, and I think what's important here is just to see how it's such a broad range of of job opportunities or volunteering opportunities, like a supply specialist. Someone would never think of when people think, public health jobs, they think, epidemiologists and biostatisticians and the likes, but you can see things relating to supply specialist or a client engagement assistant. And there seems to be quite a lot of those jobs with client engagement, which is definitely not really at the top of your mind when you think about jobs that are available in public health. I think we have one more slide and then we can jump into a few more questions and back to AI. Perfect. I like this one on which is an online um design communication strategy, for instance. Like Greg, what do you think a design communication specialist will do, online?
I don't know. I'd love to find out. It
It's
sounds super fun.
interesting, Yeah. So I think that it was just very important for us to put this on, just so that people could understand that there are opportunities, you just have to leverage on them
Yeah, 100%. I
and put
totally
yourself
agree.
out there.
Yeah, and I think, like, look, when I speak to younger people that are kind of moving into public health, the question I get all the time is, how do I get my first job? Because all the jobs that are advertised ask you to have experience. And I
Yes.
get it. That is a massive challenge. Everybody finds that difficult. So one of the things you can do is you can do volunteer work. And I know that it's sometimes tricky because you don't always get paid. Sometimes if it's on site, you might get a stipend. It's a little bit difficult. I get that. The same kind of problem applies to doing internships. So you can do an internship with the World Health Organization. I think the WHO internships nowadays are paid, but that's sort of been a back and forth contentious issue over time. But certainly some of the time you need to be doing something that you're not really getting paid or you're not getting paid much for, just to get something on your CV. Also, start something, do something yourself, start a blog, a web page. When I was younger, I started an academic journal, and it turned out to be not that difficult to get up and running. And start a
Interesting.
YouTube channel, create a podcast, do things, because all of it can count towards experience. You can point to being, stuff that you've done. So, hooray! We've got people asking questions, so that's great. People are saying
Yes.
hello from all over the place. So, welcome aboard. Great to have you all here. A question that I got asked the other day, and it came up on YouTube, on one of my YouTube comments. So I'll just put it onto the thing now, and I'm going to respond very quickly now. Do vaccines work, or are they just big pharma making money? Look,
They work, they work, they work.
vaccines work. They
They
are safe.
work, exactly.
Vaccines are safe and effective. They do what they're meant to do. Now,
Hmm.
may a vaccine have a side effect? Of course. And these things are monitored very carefully. And when you get a vaccination, you get all sorts of questions asked. I mean, do you have allergies to this, that, and the rest? Everything that can be done to ensure that vaccines are delivered in a way that is safe is done. Okay. And what you need to keep in mind, for the skeptics out there that are like kind of, oh, this is big pharma. Without vaccines, the burden of disease would be substantially, like orders of magnitude over and above what is a function of the small number of side effects that come as a function of actually getting vaccines out there.
100%.
Uh,
Yes.
you know, Smallpox alone, last century, the century during which it was eradicated, killed 300 million people. You know what I mean? You and I don't know anybody that, died from or is crippled because of polio. And that's because of the vaccine programs. You know what I mean? These things are incredibly effective. I remember during the COVID-19 pandemic, I was very close to all of the data because I was the national lead for contact tracing, and I was very close to the data, in terms of like who was getting what and what was happening in the nursing homes and the old age groups, et cetera, et cetera. And as the vaccines were delivered, we could see, and they were delivered by age group, because obviously we had to sort of stagger it. And you
Yeah.
could see as each age group got the vaccines, you just saw the incidence of COVID-19 in that age group
Just
drop through the floor. And
very
all
quickly.
of the morbidity and the mortality and the everything just got better. So, Do vaccines work? Yes, they
Yes,
do.
they
Are they
do.
just a big money-making ploy? No, that's not the case. They are an extremely effective public health intervention, and we should get behind them. And I know, look, don't even get me going on RFK. What's happening in the US at the moment, the vaccine programs are being dismantled in a way that is absolutely horrifying.
Mind-boggling, to be
It's
honest.
mind-boggling. It's just it's absolutely unbelievable. It's not based on science at
Not at
all.
all.
It's the furthest thing from science, and it's very distressing, and it's going to be very, very difficult to row that back and get things back on track. So that's just my rant on vaccines. It was asked. We've talked about it. If people can make their comments as well, I'd welcome it.
We have a few
So
more
let's
people
see. Are there any
joining
other
in.
questions that are popping into the chat?
Um, we do have Deborah giving us a feedback about what a design communication specialist could do.
Oh, okay. Yeah, tell me, what is that?
Yes, designing IEC materials and advocacy aids. So I
Popping it on
guess
the
like
screen at
if
the
you
moment.
you could be a software engineer or a software, scientist or a backend developer or something and find a UN volunteer job. Next thing you're building websites for these people,
Yeah, why not? Why not? Thanks for that, Deborah. A nice little comment from, and I don't know if I'm going to say your name right, but Fung, um, and Fung is from the Cameroon. I've been to your country, by the way. Love it. And he just says, thanks for the Global Health channel. So you're most welcome, and I'm glad you enjoy that. And interestingly, his comment is coming from LinkedIn. So we're streaming on YouTube and on LinkedIn at the moment. What I want to talk about, just while people are kind of popping in with their questions, I'm just going to talk a little bit about AI tools that can be used in public health and in research. And I'm just going to pull onto the screen one of my favorite tools. And this is Google's LM Notes. So it's notebooklm.google.com. And let me just quickly look. There's quite a lot on the screen at the moment, so let me just quickly walk you through how to do this. You create a notebook. In this case, I've created one called Environment and Health, and then you can add a source. So if I click on Add Sources, you can upload a source. It can be a website, it can be a YouTube
video.
video, it can be any. You add in as many sources as you like. I think you can add in up to 50. All right, so that's a lot, and it sticks them all here. So these are all of my sources that I've added in on an environment and health. Right, and they're big things. These are huge, big. They're either academic papers or they are UN documents or WHO reports, etc., etc. They're hundreds of pages long. It's a lot to read. And then you can ask questions. So I popped in this question here: what are the challenges to health in poor countries as a result of climate change? Right, and then it churns out quite a reasonable answer. But now here's where the beauty of this is: it just doesn't just give you an answer, but if you click on one of the sort of citations, it takes you to that document and to the section of the document where it got the
Where the
answer.
information was
So
gotten from.
it's not just, language models hallucinate, you can't really trust them. You can verify that what it's saying is in fact in the document that you've provided to it as a source.
Yeah.
And then you can take that away, as you would use that or not use it. We could click on this and it would open up that website as well. I'm not going to do that right now. So I find that extremely useful, because if you've got a lot of documents and a lot of information, you pour it all in, you ask questions, it will find within all of the sources that you've provided the relevant text. And sometimes there's more than one. In this case, it's got one and a few dots there. So you can click on that and it's got 2 and 3. So I could click on one of the other references and it finds the relevant text
Origin,
as well.
yes, of that information.
And there's the text that I found there. Absolutely gorgeous. And this is from a World Bank document, for example. So really, really fantastic. Then it does a whole lot more. I'm not going to showcase everything within LM Notes now because it would take all afternoon. But you can ask it for an audio overview, and it will literally create like a little 2-person talking podcast summarizing the content that you've uploaded. You can also ask it to create a little video, and it does that. You can ask for a mind map, flashcards, quizzes, infographics, slides. It will make all of that for you. And it is such a useful tool if you're writing something or if you're researching something and there's a lot of information and it's new to you, this is a great way to help you kind of focus in on the content that you really need to make sense of the chaos. So, and it's a fantastic study tool. I mean, you can really
As a
use
study
this.
tool.
Yeah, I mean, this is an amazing way to learn, and you can create as many notebooks as you want. I use this all the time. Like I cannot tell you how useful I find this. And I know there's lots and lots of language models that are, you can drop its PDF into ChatGPT, et cetera, et cetera. Of course, you can do all of that. Out of all of them, this is the one that I find most user friendly, and like it's my favorite. So I if people have got questions about that, you're welcome to pop them into the chat, and I'll try and respond to them.
I completely agree with you, Greg. It's the fact that it has three screens side by side. That's what like improves the usability of Notebook LM and the user experience, because you can ask the questions here and see where the answers are coming from at the same time, like in real time, kind of. And I think another interesting thing is how you can get it to explain stuff to you based off of how you learn, because some people learn with pictures, some people learn with lay summaries. I think Notebook LM is the truth. It's the way to go,
It's
really.
fantastic. I
It's the way
absolutely
to
love it.
go.
We've got Glenn saying good morning from New York. Hey, Glenn, good to see you. It
Hello,
must be early
Glenn.
in it must be morning time on your side of the world. I'm just going to get back to the question that got asked about using AI. Oh no, that's the wrong question. Here we go. There you go. Is that the question? What AI tools can we use? Okay, so
Yes.
I've showcased Notebook LM, which I genuinely think is absolutely fantastic. But let's just talk about other stuff that's out there, because I think some of the time you want to use more than one tool to get to where you're going, and research is more than just one thing. So can I just take a few seconds to talk you through different tools that I use in different contexts? So, for example, I do a lot of, if I want to do some data visualization or analyze data, and I usually do all of my data analysis using R and R Studio. Okay, that's another whole conversation. We can talk about whether R is the best platform to use. I'll tell you in parentheses, yes, it is. But, and I have an R programming YouTube channel that people can look at if they're interested. Small advert there. But so I do my coding in R, and it's actually, I find it's reasonably straightforward, but every now and again you come across problems. I use Claude. So, there's all these like language models, there's ChatGPT, there's Claude, et cetera, et cetera. Claude is great for code and generating code. You can ask it, you can just drop in a data set and ask it to generate code to do some data viz for you. It'll do it. It's most of the time produces code that's absolutely perfect. Some of the time you need to tweak it a little bit. If there's an error, you can cut and paste the error back into Claude and it'll try and solve it for you. So I find in terms of doing data analysis, data visualization, if you're doing coding, and that would apply to coding in other languages as well, if you're using Python or something else, it generates excellent code and it's very good at solving problems and addressing errors. And it's also good at helping you, even before you write the code, helping you come up with an analysis strategy. So if you say, look, I've got this data set with these variables, and this is the sort of question I'm trying to answer, how should I approach this? It gives a really, really good, strong answer as to kind of a
How
robust
to go about
research
it. Yeah.
methodologies. Exactly. I think, so I can't speak. ChatGPT is great as well. The advantage of ChatGPT is you can ask it to pull up a canvas, and then you can kind of tweak the code in the canvas and ask it to make updates and then cut and paste the code into RStudio. So okay, here's the other thing, just if people are interested. The big difference between Claude and ChatGPT is this. Claude, even with the paid version, and I have the paid version, you run out of tokens. So if you're doing a big project, you could halfway through the day get to a point where it sort of says, okay, you've used up your tokens for the day. You've got to wait for tomorrow before you can carry on. That drives me absolutely bonkers. That's never happened to me with ChatGPT. Okay,
Never.
so Claude, I think, is better, but it definitely puts a seeding on how much you can do in a particular
You
day.
can
So
do.
if you're doing something short and punchy, use Claude. If it's a big project, then maybe use ChatGPT for coding. And I think that applies also to kind of I mean, with writing, you don't use up that many tokens, but certainly keep that in mind. ChatGPT and Claude are pretty good they've both got sort of a deep research function where instead of just doing like asking it a question, and you can say to it, I want you to do sort of a deep dive on this, and you can specify that you want if you, the answer that it gives you needs to be reference actual verifiable sources and citations, and it will go and find documents and papers and pull together information for you, similar to what we just saw with Notebook LM. So my process looks a little bit like this. I sometimes ask ChatGPT to do a deep research on a subject, and it'll find the right documents. I will then go and get those documents, download them, and upload those documents into Notebook LM and work from there. So I'm using ChatGPT and Claude to help me find the right documents to do the search, and then I'm doing the work in Notebook LM. Does that make sense?
Yeah.
Mbo, what's your favorite AI? No
I
pressure. I'm putting
honestly
you on the
think
spot now.
I want to say it's Gemini actually.
Okay, interesting. Yeah, Gemini is fast. It's really
Very
quick.
fast. Yes.
Yeah. I like
And
that.
I feel that Gemini is less likely to hallucinate than ChatGPT. I like how effective and efficient ChatGPT is, and it can do quite a lot of things that Gemini may struggle with,
Hmm.
like Excel sheets. I think Gemini struggles with Excel sheets and generating PowerPoints and the likes, but it doesn't hallucinate as much as ChatGPT. ChatGPT gaslights me all the time. We have like arguments, and I'm like, I never asked you to do that. Yeah, so I have a beef, like a personal beef with ChatGPT personally. I
Okay,
think
that's
it's
so
just
funny.
my ChatGPT.
It's funny how we think of them as people now. You know what I mean?
It's
You know,
it's insane, yes.
it is hilarious.
Anil says to repeat the site or link of the app. So that would be Notebook LM.
Notebook LM.
Yes.
So the URL, I'll just read that out for you. It's notebooklm.google.com. And then there was a comment from Glenn, just sort of saying, often use it to integrate dozens of PDFs, extract data from the studies. Glenn, I take it you're probably talking about Notebook LM at the moment,
Yes.
although I had moved on to Claude and ChatGPT. So, but all of these platforms are good, and I encourage people to use them. But use them with, if LLMs can hallucinate. In other words, they can just generate information that's not entirely correct, but it just seems and sounds correct. And so you do need to double check, which is why I love Notebook LM. You can ask it to put the actual source on the screen, and you can verify the fact for yourself. And I find that an excellent safety net. I really find it tremendously useful. There's another fantastic AI for research called consensus.app. And
Okay.
consensus.app, you can ask a question, and it will go and find all the relevant papers, but it does a really good job, particularly if it's a scientific question. If there's a sort of it does a really good job of looking not just at the papers, but the quality of the studies, and it will
Okay.
rank order them in terms of the quality, the kind of study that was done. So was this a randomized control trial? How many participants were in it? So it takes all of that into account. It takes into account the impact factor of the journal that it was published in, and even the number of citations that the paper has received. So it's got multiple ways of trying to identify the best papers on a
Yes.
particular, and then it also summarizes the papers and summarizes kind of unanswered questions. And like, I find consensus.app really, really good as a kind of first stab at something that I'm not familiar with. It condenses an enormous amount of information into kind of a short, punchy kind of, and then it provides you with all the papers. You can click on the paper, bring up the PDF. You can ask it questions in the same way that you can with Notebook LM. So consensus.app is excellent. I'm a big fan of it. And with all of these things, the more you use them, the better you get at using them. Right. So I encourage people to use them because I actually think that there's a learning curve. The first time you use them, you probably fumbling around a little bit. If you use them quite a lot, you get quite good at getting what it is that you want to get out of them from them.
I agree.
And that another little trick that I discovered the other day, I was trying to get a whole lot of references that were on paper into EndNotes. And I initially asked ChatGPT, can you just take this and turn it into a file that I can upload into EndNotes? And it did a pretty bad job of it. And then I said to ChatGPT, can you help me write a prompt that I can paste into the ChatGPT agent and get it to do this for me? And it wrote a prompt that was about 3 pages long. And I cut and paste the prompt into agent mode, uploaded the references, and it took about 3/4 of an hour for it to do it, but it did it perfectly, like about 100 references, stuck them into EndNotes for me. So what I'm trying to say is that the more you use these things, the better you get at using them. And asking an AI to help you write a prompt for an AI is a nice little trick. It does a good job of that as well. Any other tips or tricks from yourself, Mbo, on an AI?
I think I would say verification is one thing, and Glenn is right on track with saying that he verifies his results from ChatGPT statistical analysis by having it generate Python, which he loads into Google Colab. I find that the more AI different AI tools you use to carry out the same task, the less likely there are to be errors. So I, for instance, would give ChatGPT a task and give the exact same task to Gemini, and compare the result, or I would get my response from ChatGPT and put that response and question into Gemini and ask for Gemini's opinion about, the
Interesting.
response. And I
Very
did have
interesting.
one situation where they had a whole back and forth. There was a back and forth between how to do Eggers test, the Eggers test for your meta-analysis.
Uh-huh.
There was a whole back and forth between both of them on how to the step by step to carry out the test. So that was interesting to see, because it made it more obvious to me why it's important to cross check and not allow yourself to be spoon fed by AI. And this goes back to people who are trying to use AI to do assignments. If you don't understand the tool you're using, it will
Yeah,
mislead you.
I 100%
So
agree. I think
it will
there,
mislead
there,
you.
there, there are certainly dangers and pitfalls, and you need to tread cautiously. And I think that you are less likely to be tripped up if you use these tools often, but cautiously, and get good at using them. And that's a lovely little trick where you get one AI to kind of double check another. I think that's quite clever. I think that, and these are the sorts of things that we need to start getting good at. So thanks very much for that. And I think we've got a comment from Christine sort of saying,
Christine.
Team Gemini. Oh, Team Gemini. I was wondering, is that like a new AI called Team Gemini? No, she's on your team. Okay,
She's
no,
on my team, yes, because
that's
it's
hilarious.
really
That's quite funny.
effective.
Thank you for that. That's really that's very cute. I'll just bring up some other questions that have popped in, and some of these are from YouTube. And we've actually addressed this already. Do I need to get experience in low
Yes,
income
we
countries
did
if I want to
experience
work in
that.
global health? And the answer to that, so the question, the comment that I made earlier was to somebody that was from India, and I was saying,
India.
great that you've got that. A question like this is often asked by somebody who hasn't got experience in a low income country, but they're interested in working in global health. And do they need to go and live in Africa for 6 months before they've got the right sort of bona fides to be able to be involved with global health? And the answer is no.
No.
It might depend on what it is that you want to do, but global health is such a broad sort of career. There are so many different aspects and angles to it. There are loads of things that you could get involved with that could use expertise from, like, I mean, I worked at the World Health Organization for a couple of years, and some of the people on our team were from the sort of uh, telephone industry, telecommunications industry. Like, people with all sorts of backgrounds land up working in global health because they bring skills to the table. If you're interested in, that kind of very frontline, getting involved, at the sort of coal face of things in global health, then you're probably going to land up in those environments anyway. You know what I mean? That's probably where you're going to land up working, and that's great. if that's not the kind of work that interests you, if you maybe, I worked, for example, for the Clinton Health Access Initiative for a while, where we were working very much on supply chain, procurement, shipping, warehousing, blah, 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 blah. A lot of that work didn't require of me to necessarily be in developing countries. Now, as it transpired for that particular job, I did travel a lot and I did spend a lot of time all over Africa. But my point is that that kind of work doesn't necessarily require that of you. And to get the job, I didn't necessarily need to have had have had a history
Experience
of a
working
physical
in,
presence. Yeah,
yes.
yeah. I mean, I suppose it did help. It helped that I was familiar with and I had worked and had experience particularly in Africa. But I definitely think, look, don't feel as if you haven't spent time in a poor country, you're not eligible to work in global health. That's not entirely the case. There's all sorts of things you could get involved with. So, any thoughts on that, Mbu?
I would say there is so many jobs in global health that even directly involve low to middle income countries that are based outside of those countries. So you could have people who are running statistics for jobs there and they never even get to step foot in the countries. So I definitely think you said it all. It depends on what kind of jobs you're interested in. There are certain jobs where that experience will make you a premium candidate, but it's never a prerequisite for so many other jobs. So
Yeah,
put yourself out
100% agree.
there.
Yeah. That's definitely true. Just a comment from Jessica Block, and I think she's responding now to what we were saying
The
earlier about
vaccines,
vaccines.
the
It's
vaccines.
true. I mean, in the US, it's crazy what's happening in public health. Yeah, look, it is a difficult time, and it's a difficult time in the US in terms of a lot of what have been kind of extremely strong and reputable and effective public health institutions like the CDC are getting a bit of a clobbering, to say the very least, and it's very sad to see. Um, and hopefully this is just a season, and with time all of this is going to turn around. It's at the same time it's also difficult. The US has historically been an important funder of a lot of global health programs,
That's
and
the
a
point.
lot of that has dried up and has stopped,
Fundings are
and
being
that's
cut
also
off.
extremely sad to see. And and again, hopefully this is just a season. Hopefully this all gets turned around, and with time, we go back to kind of that deep involvement of the US in these global health issues, because they've historically been such an important partner for global health initiatives. I mean, they've really been an important kind of central figure, and it's just it's heartbreaking to see what's going on. I also hope that right now, while so much of the funding has kind of stopped, that other countries and other, like the EU, et cetera, kind of step up and meet that shortfall, because we really can't afford to see people just suddenly not being provided with ARVs because they have HIV. And
Yeah,
you
and
stop
different
treatment,
medications.
and very quickly a person that stops the ARV medication will start getting a viremia, and they become infectious. Other people will be infected, and we it's a huge problem. So I like I you know I feel for people in the US, because I think it's a difficult time there, and I know lots of colleagues in other parts of the world that are also being affected by the current administration's policy towards the involvement with global health. So let's just hope that all of this kind of settles down. Um,
I'm with regards to these issues. I think I was still doing the MPH when the CDC problem started at first, and I had a whole crash out because I thought at the end of the day that this situation has a little bit of a merit in the sense that it is a wake up call to so many other countries, including the EU, about the over reliance on one country for data, for funding, for everything. Because it dawned on me, like they say, the CDC says, you know what, we're pulling our data, and everyone is panicking. And I asked myself, why is there so much panic? I understand why there's so much panic, but the problem is that level of panic is because so many other countries have been over reliant on them, including the African CDC. And
yeah,
I find that this is an opportunity for some of these low to middle income countries, especially the African Union, to band together. And it's a wake up call.
Yeah, well, it is a wake-up call, and actually, the comment that Glenn has made in the comments is along the same line, saying the silver lining is with the youth withdrawal might be that we have a more pluralistic WHO, not dominated by a single
Yes,
factor. I think that's definitely true. Um, and it's not just the WHO. I think global health needs to not be reliant on a
on
single
one
country.
person.
Now,
Yes.
the US's contribution to global health has been substantial. But in terms of like the percentage of GDP that the US provides to sort of international aid and development and health, the US ranks about 17th in the world in terms of the percentage of its GDP that it gives. So it's actually not the biggest donor in terms of what it could give. But because the US is such a big economy, its withdrawal from the space is
Left a
devastating.
huge dent.
And I
Yes.
think that that's what we need to guard against going forwards. We need to make sure that, like exactly as what Glenn is suggesting here, and what you've just said, there, Mbo, that we make sure that we're not at the behest or beholden to a single country or a single person. Like, to be honest, I mean, for example, the Gates Foundation, whom I love, the Gates Foundation are amazing, but they do actually donate quite a lot of money to the WHO. And well, historically, I don't know what the case is anymore, but when I used to work there, the Gates Foundation did give a lot of money, and they were an extremely powerful voice in that space. I'm not sure that it's healthy for an organization to have such a strong voice from such
One.
a small
Yes.
minority. Even though I absolutely adore the Gates Foundation and I love what Bill Gates do, and all of their interventions I thought were positive, it's still something that we don't want. There shouldn't be that kind of reliance, and I think that that's what Glenn's kind of getting at, and I completely agree. We have to tread cautiously. We need to make sure that if the winds of change suddenly turn, we're not caught off guard like we have been in this particular
Mhm.
instance.
Yes.
Um, okay, now more questions and comments. Oh, hang on, I just got rid of all of our. Let me get them back. How do I get them back? Comments are back.
Back. Yes.
So Justin, I haven't read this comment, so I'm just going to read it as we talk. Public health needs to work on how
Communication.
they
It's about
communicate
communication.
to the general public. I agree. Okay, where low health literacy rates are high and distrust in public health is on the rise. I agree completely. Um, Okay, and saying that vaccines are safe and effective doesn't go far enough. It's better. Look, we definitely need to get better at how it is that we communicate with the public. Like 100% agree with the sentiment there. We can't just be screaming from the rooftops that the vaccines are safe and effective, like I do.
But
we
they are
actually
safe and effective.
we actually need to better understand what people's concerns are,
Are
address those concerns, and try and in a very clever way counter misinformation that's out
misinformation and
there,
disinformation.
and disinformation. I
Mhm.
like and stuff that's sort of pseudoscience. There's all sorts of things flapping around. And what isn't effective is just getting into a shouting match. We need to be better at communicating useful and effective information, and not just shouting and screaming. I agree with the sentiment there, Justin. Thanks very much for that comment. Um, a comment from now. I'm not sure how to pronounce your name. Do you want to have a bash at that name there for me, Mbo?
I'm trying so hard. I'm not gonna go with the first one. I'm gonna go with the last one and say Asaye.
Good idea. Good
Yes.
thinking. Okay. Thanks very
Or the
much. And
middle one and say Tilahun.
absolutely no offense to anybody if we struggle to say your names. We're literally doing this live. We're seeing things for the first time, and people from different countries and languages often have names that I live in Ireland. I can hardly pronounce, and
Shasha.
oh, the names in Ireland drive me bonkers. And the way they're spelt is absolutely bizarre. And I am quite often kind of caught off guard. So it's
I try not
names
to try until I've heard the name being pronounced at least once. So I don't even attempt.
exactly.
Y- Especially
Um,
when you have two consonants following each other, I don't go near them.
and listen, thanks for the comment. Public health informatics. I'm greatly understand the impact of AI in health, especially for Africa. African healthcare systems. You know, let's just talk about AI and health for a few seconds, because I think there's a lot there's a lot to be said here, and we maybe need to do like a whole live stream where we just focus on AI entirely. Of course, there's the stuff we've just spoken about, how to use language models to help us with research, et cetera, and I think that's all very exciting. There are lots of other important implications of AI in healthcare. And just to name a few, but just to state the obvious, you know, AI in diagnostics, huge. The
Radiology,
ability
yes.
of these neural networks to look at CT scans and X-rays and retinas and all sorts of clinical diagnostic requirements, and are better than people for the most part. That has massive implications for low income countries, because where they can't afford to have an army of radiologists, they can get an AI to be looking at these things and have one or two radiologists doing a kind of high level sanity check on things. So huge implications for human resource deficiencies or deficits in poor countries. So that's great. The other thing that's really exciting now, what is the name of it? It was called, I can't remember the name of the AI, but it AlphaFold. AlphaFold is an AI that was developed, this is a couple of years ago, that can predict the shape of a protein fold, the way proteins fold. Now,
Interesting.
that doesn't sound terribly exciting. You sort of think, well, you know, so what? Okay, proteins are made up of a string of amino acids, and you know, they could be sort of 100 to 200 amino acids long. The number of ways that this thing can fold, oh no, even longer than that. But the point is, the number of ways these things can fold up are, you know, like, you know, in the orders of like 10 to the power of 121 or something like that. It's more than the number of atoms in the observable universe. You know, that's the number of ways a single string of amino acids can fold into a single protein, right? So that it's seemingly incalculable, but the way these things fold up matters, because it translates into the shape of the protein, and the shape of the protein is why it is effective. It works as an enzyme, or you know,
Enzyme, yes.
it binds to this or binds to that, or all its physiological and biological parameters are a function of
It's
its
based
shape.
off of the shape. Yeah.
And we've never known how to work out the shape, other than doing what's called crystal radiography or X-rayography or something like that, where basically we look at it, we take multiple photos of it using X-rays, and it would take about 4 years to figure out the shape of a single protein. Now, AlphaFold will do tens of millions of them in a few seconds, and it gets it almost entirely right. And the implications thereof for research and new drug development are phenomenal. Now, we won't see drugs today or tomorrow. It might take 10 years before we see, you know, the real impact of this, but I think we will see it. And I think it might be the sort of thing that brings down the price of medicines and drugs substantially, which means increased access to medicines even in low income countries. So things like AlphaFold seem a little bit sort of high tech and something from Silicon Valley. I think it'll have huge implications for people living in poor countries in the near future. So, you know, AI is here to stay, and I think there's really exciting things happening, notwithstanding the risks, you know, the Terminator 2 scenario where AI takes
Yes.
over the world, you know, so we want to try and avoid that if we can. Um,
You know, it's also
any other,
really good for language, you know? Like I've
yeah,
always thought about how much um AI can be utilized for translation services in African countries, because in Nigeria, for instance, there are like 700 dialects. They don't
right,
sound alike. Yes, 700.
right.
So, yeah.
That's
So
remarkable.
imagine if you were posted just 20 minutes away, they may be speaking a different language from what you speak. And I'm being quite realistic. I come from a small village. 20 minutes down the road, they don't speak the language I speak, and I have no clue what they're saying.
Wow. Okay,
Yes.
phenomenal. That's
Yes.
unbelievable. Well, look, I think unless there's any other questions, I'll give people just a few seconds to pop in any sort of last minute questions into the chat. If there aren't, then we've been going for about 45 minutes, which is about, or nearly 50 minutes now, which is about the length of time that I want to keep these things to. So thanks everyone for tuning in. If there's a last question that pops in, we'll respond to that. But Otherwise, everybody have a great weekend. Don't do drugs. Don't always do your best. Don't ever change. Boom shakalaka, etc., etc. Mbo, thanks for joining us. You're always an
Thank you
absolute
very
pleasure
much for
to talk to you.
having
I love
me.
your laugh. I love your smile. I love everything about you. Don't ever change. And
Thank you, everybody, for joining.
thanks for joining. Thanks, everyone. Take care.
Oh, one
Oh,
last
hang on.
one.
Okay, one last question. One last question. Glenn was quick off the mark there. Ironically, our FDA change with safety will become tomorrow's bottleneck. 5 to 7 years of trials and 5 billion later. Yeah. I mean, it is. These are things that we need to get better at, and that is the pipeline between discovery and something being on the shelf that can help people. You know, with the COVID-19 vaccines, I remember we managed to do it quite quickly. It was, you know, actually remarkably quickly, but off the back of that, programs started getting developed where they were saying they want to be able to, in the event of another pandemic, have a vaccine actually being deployed to the public 100 days later. So just over 3 months. Now, that would be remarkable. And if people that are thinking about this and planning around this get it right, that would be an absolute game changer if we were ever faced with another
Able
sort of
to get that.
COVID-19
Yes.
type. But it is true at the moment that there's an extremely long lead-in time between something being discovered and it being available to people. So that's a good point. So as we say, we're going to leave, the people start asking questions and things and popping in comments. So that's great, though. Hang on, we had it. Here we go.
What AI tools can help with PPU/E?
Okay, I'm going to come back to that one.
Patient and public engagement. Okay.
So great discussion. I worked in the HSC in Ireland. Me too. So hi, Vincent. But good to get the AI tips. Okay, you're most welcome, and thanks for the comment. Much appreciated.
Thank you for joining.
So we've got any other last minute comments? Public and public, yes, 100% agree. Yeah, okay. Look, guys, this has been lovely. I have a lot of fun doing these. We've got to do more of them. I think like end of the day on a Friday is a nice time to do it. You know, most of us have stopped doing anything productive by 4 o'clock on a Friday, and it's a lovely time just to sit down, have a conversation, and talk about what's happening in public health and AI, et cetera, and global health. So thanks for tuning in. Thanks for the questions. I appreciate it. Thanks, Mbu, for just being here. Your
Thank you
insights, your
very
thoughts,
much.
and your lovely
You
smile.
can
It's
leave
always
your
great.
questions and we can answer them next week or
Exactly.
when
You can,
next we do this.
yeah, and let's try and do this again next week.
Yes.
And yes, you leave questions and we can respond to them in the next live stream.
Have a
Okay.
lovely day and a lovely weekend.
Yeah. Now
Bye.
I need to figure out how to push
How
stop.
to log out.
Where end stream. Here we go. Okay. Goodbye, everyone.